I'm Llewellyn Meister, and this is our Havanese Jake, Jake Meister. Things were getting a little blurry, and that I noticed when I would try to read the newspaper, I wasn't seeing it as well, even with my readers on. And sometimes I thought, gee, maybe I could even see better if I take my readers off. And of course I had readers everywhere around the house. Every single countertop and every single desk and everything had readers on them. My far vision was not as sharp, and that I couldn't see the street signs or something like that, or directions, exit 13 coming up, until I was, almost up to it. So I really needed, and I couldn't see people distinctly if they were off somewhere in the distance. So I had the Tecnis lens implant. I had cataracts, and when they were ready to be done, Dr. Pascucci obviously kept track of them to let me know when I should have it done. Dr. Pascucci explained to me the difference between them, which is really very minor, and he was right. He said most patients, when I explain to them what each one does or how they might differ a little bit, patients pretty much pick their own. They can tell what activities they do. That mostly, do they read, do they do computer, do they do close needlework, and then he will kind of tell you, well, this one does this better and this one, so then you sort of self-select. I do more reading, and I don't spend hours in front of a computer. And I guess that would be one of the big differences. If you were in a job where you really were at the computer a long time, then you might want the other lens, the Restore. But for what I do a lot, because my husband and I are retired, and I do a lot of reading now. And well, we watch TV, but that's all right. And that was mainly why he thought the Tecnis would be better for me. The clarity, it's almost immediate. Things are just much better right away, and there's no waiting period as far, 2 or 3 weeks it'll be a lot better. So it's wonderful. I can see at a distance. I don't have glasses for anything anymore, anything.